As many people look forward to returning to some sort of normalcy, health officials are warning people to take the virus seriously. Earlier, I spoke with Dr. Jim Shames with Jackson County Public Health about concerns he has about moving forward. So tell us a little bit about your major concerns as we start to head into Friday and what may be coming for you and our area in the future.
Well, I'm just afraid that our whole region may be a little lulled in complacency. We've done a great job, bent the curve. We've seen hardly any new cases in quite some time, which indicates we don't have a lot of virus circulating in our community now. But it's pretty clear. I think people are getting cabin fever. They're ready to go shopping. They're ready to go to restaurants, play sports together. And I think it's almost inevitable that we're going to have more cases soon after we open up. At Public Health, we're trying to encourage everyone with any symptoms to get tested so we can identify cases early. We want to do aggressive contact tracing. We'll do our best to protect the community as this phenomena happens, but I would encourage people not to let up on their vigilance. This disease is easily transmitted. Certainly when you put people indoors together, we need to be wearing masks anytime you're indoors around others. And for courtesy's sake, probably when you're outdoors walking around as well.
You mentioned testing. I know we have spoken in the past. You said you had some tests, but not all the equipment needed to provide those tests. Has that situation reversed? And do you have the contact tracing team in place that you also feel comfortable with?
Yes, in both counts. I think we have greatly increased our testing capacity. We have a lot more diversity of testing so that if one system goes down, there's other systems that can come and take its place. We probably don't have enough testing, but we have more testing, and I think we have enough to open up and get started, yes.
I probably know the answer to this. When people go back out, obviously social distancing and personal hygiene habits are something we should, as you said, keep in our forefront of our minds. If you had to advise people where not to go as they try and break out of that cabin fever as you described, where would you say best to try and eliminate from your activities?
I would not go anywhere indoors in tight quarters with others, in particular if everyone is not masked. If you're in a place where some people are wearing masks, some people aren't, some people are laughing and talking and congregating, and they may feel they have a right to do that, but it actually puts everyone else in that same airspace at risk. So if that's the situation you think you're going to be going into, I'd avoid going there.
Local restaurants are preparing to possibly open back up if the counties are approved to open on Friday. But not every restaurant will open on the same day, and they will have some new challenges to face. Not only do restaurants have to hire their staff back, which can take on some time, but there are new safety measures in place. Dine-in will have to keep tables 6 feet apart, and the way people consume is also going to be changing.
I'm sure there's going to be folks that, even if we're open, are still not comfortable going out in public and would prefer to have their food delivered or just pick it up. So we're going to need staff to help with that, as well as man the restaurant for those folks that choose to dine in.
Coming up on Newswatch 12 at 6, how realistic it is for places like Bella Union to reopen the day that the county will allow it.